Oh, I need an anti-emetic drug, which comes in IV form or tablet form. Hello, my name is Audrey Mitchell Carpenter. I am a nurse practitioner student at Auburn University. Sorry, today I will be talking to you about the 5-HT3 antagonists. There are 4 that have been approved by the FDA, which is polonoserone, dolacetrone, ondansetron, granisetron, palonosertone. The action of these class drugs is to manage nausea and vomiting by blocking the serotonin at the 5-HT3 receptor sites. This is located in the vagal nerve terminal and the chemoreceptor trigger zone. The therapeutic effect of these drugs is to treat and prevention of nausea and vomiting in patients receiving chemotherapy, induced radiation, and postoperative surgery. The pharmacodynamics of the drugs are that they block the serotonin receptor site peripheral on the gastrointestinal vagal nerve terminal. The pharmacokinetics of the drugs that all 5-TH3s are well absorbed and effective after oral administered and absorbed and metabolized by the liver. So a screening precaution must be taken with patients with hepatic impairment. These drugs are distributed across the blood-brain barrier and moderately bound to plasma protein. The excretion is 45% to 60% in urine and fecal matter. The pharmacotherapeutic of these drugs is precaution is used in patients with history of cardiac disease, like EKG changes, prolonged QT intervals, AV blocks. Also, precaution needs to be taken in patient currently taking SSRIs, SNRIs due to the serotonin syndrome, and patients with liver impairment should not exceed 8 milligram dose per day, which would be 1 tablet. These 5-TH3 antagonists may mask progressive ileus in patients who have had abdominal surgery. Contraindications are Zofran or disintegrated tablets containing aspartame and should be used with precaution in patients with PKU. In ondansetron, granisetron, and palonosertron are pregnancy category B, meaning that the medication can be used routinely and safe during pregnancy. Adverse reaction of these drugs consist of constipation, headache, fatigue, dizziness, diarrhea. Less common concern are rare cases of tachycardia, bradycardia, and hypertension. Drug interaction. The ondansetron decreased the effect of the phenytoin, the CYP3A4, with apomorphine, which is used in patients with Parkinson's disease. It may increase the apomorphine levels. Indication and clinical use is prevention in nausea and vomiting following chemotherapy or surgery with dolacetrone. Zofran is the prevention of nausea and vomiting associated with chemotherapy, post-operative nausea and vomiting, and gastroenteritis. The rationale drug selection. Because of their low side effects profile and tolerance, the 5-HT3 receptor antagonists are being used extensively to treat nausea and vomiting. Monitor patients if a single dose or very short term. No specific monitoring is required besides that associated with the disease process. Patient education. Administer these drugs. Make sure the patient take medication as prescribed. All injections should be administered deep into the well-developed muscle, avoiding deltoid and subcutaneous site. Liquid form use a measuring device to attain accurate dose. Lifestyle management. Non-pharmacological interventions can be tried, like resting the GI tract for about 8 hours by taking only clear liquids in small amount. After 8 hours, they can maybe start bland foods. No alcohol use with this medication. Report any involuntary movement, eye, face, or limb that occur. Just because you suffer with an illness or disease, that doesn't mean that you have to put up with the nausea and vomiting that follows up with it. The main takeaway from this drug is that these drugs used for treating and preventing nausea and vomiting following chemotherapy, induced radiation, and post-operative surgery. Do not drink alcohol with this drug. Precautions should be used in patients with cardiac disease and patients currently taking SSRIs, SNRIs due to serotonin syndrome, and precautions with patients with liver impairment. Remember, they should not exceed 1 tablet per day. I think I better have 1 tablet of Zofran. Thank you for listening to my anti-medic spiel.